Hi Shifra, I'm Dina Blumenfeld. I'm just going to be checking your swallowing today and looking at your oral structures and your throat, and I just want to make sure that your swallow is functional and safe. Okay? As I put on my gloves, I'd just like to ask you if you can please hold your breath for about 6 seconds. Great. And that just gives me an idea of how you can, manage your breath while you chew. Okay, so I'm looking at your face, and I notice that everything's symmetrical, and I don't see any lumps or bumps or scarring around your throat. And what I'm going to do now is I'm just going to take my tongue depressor and my light, my flashlight, and I'm just gonna look at the oral structures in your mouth. So not looking at the function, I'm just looking at the structures. Okay, if you can please open your mouth for me. Okay, I see that your soft palate is normally vaulted. I see your uvula, your lateral sulci, your lower teeth. Okay, great. Everything looks normal. Good job. Then I'm going to ask you we're going to look at your jaw, functioning now. If you can please open your jaw like this and then close. Great. Okay, so now what I'm going to do is I'm going to add some resistance, and I'm going to take my fingers, and I want you to open your jaw against the resistance of my fingers. Very good. And I'm going to ask you to open your mouth, please, and try and close your jaw against the resistance of my fingers. So close, please. Okay, great. Thank you. Okay, so now I'm going to ask you to move your jaw, please, from side to side like this. Good. And please protrude your jaw, like pull it out, and retract. Okay, thank you. So now I'm going to be looking at your lip function. If you can just purse your lips, please, like that. Smile really big. Good. And if you could just keep your lips closed and try and fill your cheeks with air like this. Good. That just gives me an idea of your lip seal. Okay. Now I'm going to take my tongue depressor. I'm going to put it between your lips, and I want you to hold it together there without using your teeth, just your lips, and try and hold it tight together, and I'm going to tug and try and pull away. Okay, good job. You can let go now, release. Doing a great job. Okay, now I'm going to be looking at your tongue function. So I'm going to ask you if you can please stick out your tongue all the way as far as you can, and keep it straight instead of down, straight up, and move it from side to side, please. Wonderful. Okay, now I'm going to ask you if you can please clear, and pretend as if you have peanut butter at the roof of your mouth and you want to clear with your tongue by moving it back and forth against your palate. Great. Okay, good job. And then if you can just pretend, take your tongue tip and pull it out like so, and as if you're licking your lips, so top lip over here, all the way around to the corner, and then on your bottom lip, same thing, like this. Okay, good job. Now, if you can, I'm going to put my hands against your cheek, and I want you to press your tongue against my fingers on this side, and then again on this side. Okay, good. And the last thing that I'm going to ask you, if you can please open your mouth so I can see your tongue and retract it all the way as if you're saying gaga. Perfect, that's absolutely perfect. Okay, so now we're going to do some sounds. I'm going to start with pa 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 pa, and I'm going to ask you if you can say that continuously until I ask you to stop. And I'm going to count for about 10 seconds, and then I'll let you know when the time is up, and you'll stop saying the sound. So when you're ready, go ahead. Okay, good. That was very good. And now we're going to continue again, same thing, but with the sound ta 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 ta. Go ahead. Good job. All right. You're doing great. And now we're going to again with ka 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 ka. Go ahead, please. It's okay. It's okay. Would you like to try again? It's okay. Let's try it again, please. Okay. Starting now. Go ahead. Okay. Good job. Now what I want you to do is to put the sounds together as if you're saying pataka, pataka, pataka. Or if you prefer, some people have a much easier time saying buttercup. If you'd like to go that route, we can. Buttercup, great. And again, you're going to just continuously say buttercup until for about 10 seconds, and then I'll tell you to stop. All right, go ahead.
Buttercup, 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 buttercup.
Okay, good job. Good job, excellent. Okay, now I'm going to ask you if I can look at your soft palate. I'm going to have to use my tongue depressor again, and I might have to be a little bit more aggressive to hold down your tongue. I'm going to use my flashlight. Should have been a pen light, but small enough. And I'm going to look inside your mouth, okay? I'm going to ask you please to say ah.
Ah.
And if you could just raise your chin up a little bit, like look up so that I can get a bit. Okay, so say ah, please.
Ah.
Okay, everything looks normal. I can see here the back of your velum lift up, very normal. And now I'm going to check your gag reflex. It's not very fun. I will be just I will move along just a little bit, just to see when as soon as I just hit, you barely begin to gag, I'll move back and it'll be over. So it won't take very long at all. Okay, so if you can open your mouth, just let me know when. Okay, all right, it's over, that's done. Sorry about that. Okay. Now I just want to know if you can feel inside something that touches your mouth. So I'm going to take my tongue depressor and I'm going to put it to one side of your mouth, and I want you to raise your hand on the side of the mouth that I'm touching, and then obviously I'll do the other side and you can raise the other hand, all right? Just open your mouth, please. Very good. And now the other side as well. Great. Good job. Okay. And now the oral part is finished, so that's done. And I'm just going to be looking now at your throat and I just want to make sure that your larynx and your pharynx are functioning normal and they're safe. So I'd like you to say, nice and clear for me, ah.
Ah.
Great, okay, nice, strong, normal. And now I'd like to hear your phonation time. So if you can I'm going to ask you to say ah again, but this time take a deep breath and just say it for as long as you can. And I will try and I'm going to count while you do this, okay? So, okay, 1, 2, 3, go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30, 31, 32, 33, 34, 35, 36, 37, 38, 39, 40, 41, 42, 43, 44, 45, 46, 47, 48, 49, 50, 51, 52, 53, 54, 55, 56, 57, 58, 59, 60, 61, 62, 63, 64, 65, 66, 67, 68, 69, 70, 71, 72, 73, 74, 75, 76, 77, 78, 79, 80, 81, 82, 83, 84, 85, 86, 87, 88, 89, 90, 91, 92, 93, 94, 95, 96, 97, 98, 99, 100, 101, 102, 103, 104, 105, 106, 107, 108, 109, 110, 111, 112, 113, 114, 115, 116, 117, 118, 119, 120, 121, 122 Perfect, that's exactly normal. That was almost about 19 seconds, and that's very, very normal. Now I'd like to check your pitch, please. So if you could say, ah, good job. And I'd like to know if you can cough, just cough a minute. Good job, and could you clear your throat? Very good. Now, before you do this, I'm going to ask you to swallow, but before you do, I'm just going to place my hands on your throat in certain areas just so that I can make sure that I can, see exactly, I can feel and see how your swallow is. So I'm going to just come over here. I'm going to put one finger underneath your chin. I'm going to put one at the junction of your throat and your neck. I'm going to put one under the thyroid notch, and then one right below that. Okay, and please swallow. Okay, perfect. That was very normal again. Everything is moving just as it's supposed to. You did a really great job today. Thank you. I'm just going to take off my gloves in the very appropriate way. And thank you for helping me out today.
You're